All right, performing defibrillation. Use the AED by a single EMT. Simultaneously verify that the patient is unresponsive, no breathing, no pulse. Call for additional EMS and the AED. Immediately begin chest compressions and apply the AED as soon as it is available. Minimize interruption of compressions. A pregnant patient in cardiac arrest who is at 20 weeks of gestation or greater, it is necessary to place the patient in a supine position and to manually displace the uterus off the vena cava when doing chest compressions. All right, the baby's pressing down the vena cava. You're doing chest compressions. That blood is going nowhere. Transporting. The patient you transport after defibrillation will be in one of two conditions, with a pulse or without a pulse. All right. After emergency care procedures and operating the AED, if ALS is not responding to the scene, transport if the patient regains a pulse or your protocol indicates transport after a prescribed number of shocks or no shocks indicating messages. Transporting the patient with a pulse. Check the patient's airway. Provide oxygen at a liter flow to achieve and maintain an SpO2 of 94%. If the patient's breathing is adequate, or provide positive pressure ventilation with supplemental oxygen if the patient's breathing is inadequate. Provide only enough oxygen to achieve and maintain an SpO2 of 94% or greater. All right, because many cardiac arrest patients vomit, have suction ready for use and clear the airway of any obstructions or fluids. Secure the patient to the stretcher and transport them to the ambulance. If you regain a pulse while still on scene, the patient should be placed on a backboard so that compressions are more effective if the cardiac arrest reoccurs en route to the medical facility. Consult with dispatch and medical direction and consider rendezvousing with an ALS unit en route or waiting arrival of the ALS unit if that will get the patient advanced care more rapidly. Always keep the AED attached to the patient during transport. Perform your secondary assessment en route and perform reassessment every 5 minutes. The patient has no pulse. Continue to provide CPR, defibrillation, and follow your local protocol. Assess the patient's ventilation status carefully for effectiveness of the tidal volume and respiratory rate. If either the tidal volume or respiratory rate is inadequate, continue positive pressure ventilation. Do not hyperventilate the patient. The adult patient should be ventilated at a rate of 10 to 12 per minute, and the child or pediatric at 12 to 20. Excessive ventilation can reduce the cardiac output and cerebral perfusion if the patient has a lower blood pressure with ROSC. During cardiac arrest, oxygen is applied to the ventilation device and delivered in a manner to provide the highest concentrations possible to 100% to the patient after the patient has regained a pulse. AHA guidelines recommend oxygen delivery be reduced to the minimal liter flow to keep their SpO2 at 94% or higher. All right, the fourth and fifth link of the AHA's Chain of Survival advocates for advanced cardiac life support. All right. Whenever you have a cardiac arrest patient, follow your protocol, which may include informing medical direction and requesting ALS as possible for backup. Okay. How long do we check a pulse for? Fantastic. All right, so we've already gone over all this. All right, TESS is assessing the patient's ventilation. TESS is assisting the patient's ventilation with a BBM, supplemental oxygen, as they begin transport to the emergency department. 2 minutes into the transport, the patient becomes unresponsive, has agonal respirations. Steph quickly checks for a carotid pulse, but cannot detect one. What is the sequence of steps that they must take to minimize or maximize the chances of successful resuscitation? Start CPR. What kind of safety concerns are there in carrying out those steps? If you're 70 miles an hour, 85, 90, Suzanne's driving down the interstate.
Suzanne don't know how to drive. It's going to be difficult, is it?
It is.
Suzanne is a fine lady.
Just the road quality is going to make it difficult to do CPR, especially
Shit road quality.
around here. I know. All right, some safety concerns. You want to clear everyone from the patient before delivering a shock. Do not defibrillate a patient who's wet. Dry them off. Use caution defibrillating on metal surfaces. All right. It is electricity. If you are touching the metal when the shock is delivered,
Kill 2 patients.
remove transdermal medication patches on the chest. Remove excessive chest hair. All right. Yeah, you want those in.
I'll have what?
Piercings.
You can only touch that piercing.
Huh? Yeah. Schedule maintenance of your AED is critical. Replace the batteries on schedule. Allow the machine to perform the self-check at the beginning of the shift. Have extra batteries available. Refresh and maintain skills through continuing education. Have an incident review and maintain your knowledge of protocols. All right, medical direction. AEDs are used under the authority of a medical director. Medical directors play several roles in AED programs, including ensuring that you have the skills and quality to use it. Do not place the AED pads directly over a pacemaker. This is what a pacemaker looks like.
Our odds are that like paramedics we don't actually shock them. They actually gonna let us shock people.
What?
They actually gonna let us shock people.
Who?
Like paramedics, we're gonna talk like shock people, not paramedics.
If you're working on a basic truck, yes. All right. You can also find pacemakers in kids. Okay. All right. Automatic implanted cardioverter defibrillators detects rhythm disturbances and delivers shocks. Do not place the AED pads over these. Be in the same place as the pacemaker. Okay. Chest compression devices. These are actually pretty freaking cool. We had these at the last place that I worked. It's called a Lucas device. There's several different kinds. And it's a mechanical piston. You place it over the chest and it does high quality CPR for you. All right. This is what it looks like.
Extremely expensive.
Not really.
You have a question. So
What?
if I have a pacemaker, where do I place it?
Beside it.
So you just put it off to the side away from the pacemaker, or you have to put it on the opposite side of it?
Don't put it on the opposite side. The electricity through your heart goes from the top to the bottom. Don't put something on this side over here. Put it over on the other side, or this side, or on top of it, or below it. Don't go to the other side.
Basically feel where the pacemaker ends and then move it to the edge.
Yeah. Signal the EMT who is driving to pull to the side of the road. Stephen Mill begins chest compressions. His test continues airway management. They perform CPR with a ratio of 30 compressions to ventilations. As an EMT from the engine attaches the AED. The AED detects a shockable rhythm, and after clearing the patient, the EMT delivers a shock. Test immediately resumes chest compressions, and they resume transport. 2 minutes after defibrillation, Steph stops CPR to check a pulse. The patient has a weak radial pulse. Test continues ventilation, and Steph gives an update to the receiving hospital. All right, shock is a critical condition. It's characterized as hypovolemic, distributive, cardiogenic, or obstructive. The name implies the actual etiology of the poor perfusion state. Types of shock include hemorrhagic, non-hemorrhagic, anaphylactic, neurogenic, cardiogenic. Can progress through 2 stages: compensated, decompensated. All right. Chain of survival. Immediately recognize, activate 911 or AED. Early CPR, rapid defibrillation, effective ALS, and integrated post-cardiac arrest care. All right. Do anybody have any questions about that?
So you mentioned having to change the battery.